it's Dr. Linda here from beautiful, sunny Southern California with our #1 requested doctor expert for our Facebook Live session, Dr. Stuart Nelson.
Good evening, everybody.
Of the Beckman Laser Institute. Sure, he's here, very excited over the Green Bay Packers winning last night.
Yes, go Pack, go.
Go Pack, go. And today we are going to be talking about the latest treatment options. Now, I'm watching here. I'm not seeing anybody pop on. Oh, good. Jody just came on, Jody Mowers, so that's great. I just want to see if it's popping up live on my, yep, there's Gabriella. Hi, Gabriella. And we can take your questions. We will be talking today about the laser treatment options and the pulse-dye laser, the new Crema Laser. I'm looking for this to be on my phone. I'm not seeing it pop up yet. I see Jody on here, and again, I always have a hard time with making this scroll. Where is the thing for scrolling, Stuart?
It should be.
It's not showing on my phone. I thought it was there. Oop. Kyla Manny's on there. Maybe it'll just keep scrolling up. I don't know, but it's not popping up on my phone yet.
Maybe we have to get all the way up to the top.
All right, let me just see. Now it should be. Jody's on. Shalia's on. Hi, Shalia from Bangladesh. Cassia Elliott's on. Donna, hello. I'm on my small phone here, and I think I just saw it live. So I can, let's see, welcome. Okay, so it's there on my page. Let me just see. Okay, oh, I gotta turn the volume down. Sorry, people. Okay, volume down. All right, so we are, hi, Eric. Eric Pixley is on. Our global ambassadors are on here, so this is great to see. So today, let's get your questions for Dr. Nelson, because we only have 60 minutes. Oh, and hi, Hiroko Nagasawa. Good morning from Vientiane, Laos. So maybe Vietnam, Laos. Oh, there it is. Okay. Okay, good. Great. Perfect. Eric's on. Hi, Roy. So let's start with your questions. So today we want to talk and we want to receive your questions about
Hi, Carrie. Say hi to Jeremy.
Yep, about the laser. Dr. Nelson is having some results with the new, hi Scott, Scott's on now, with the new Crema Laser. You said you're happy so far with your preliminary results. There's some cautions, I guess, right, that things always need to be kind of worked out when you have a new laser. So you're working on working that out. Hi from Minnesota, Allie Lynn. Scott saying, hey, Scott, you missed our comment about the Green Bay Packers winning last night. So I'm sure you're going to give us 2 thumbs up for that. Dylan James is on there. That's Dylan Haran. Hi, Dylan. Wendy's on. Hi, everybody. So again, questions regarding diagnosis, treatment of vascular anomalies, primarily the lasers, the pulse-dye laser. Dr. Nelson and I have been talking about the IPL. He doesn't have experience with it yet, but we're hoping to connect with the company so you can test it out, get some studying done on that IPL. I've been hearing from my friends in Russia, Olga, hi from Kansas, Aaron and Sandy Perry's watching too. So I'm hearing from some people in different parts of the world. Ontario is on right now. Hi, Sandy. And from Trinidad, Sally's on. We have one of our ambassadors, Kiana, is from Trinidad, Sally, so I'm not sure if you know her. Okay, will the laser work for port wine stain with the blebs? Will it work on the blebs?
Absolutely. That's one of the best indications to use the laser. It does require focusing the beam down on a smaller spot so that you can increase the energy of the laser so that you can flatten and smoothen out the bleb or the nodule. But the laser actually works very, very well for that, particularly the new long pulsed ND YAG laser, which is a new feature on the V-beam Prima. where you have both wavelengths to use.
So have you used that on any blebs?
Absolutely.
The new Prima?
Yes, absolutely.
Okay, and you're happy with the
Yes, and
results?
vascular venous malformations, it works well, very, very well for that as well.
The superficial ones?
Yes.
Okay.
Yes.
So Dylan wants to know, what are some of the cautions with the new Crema Laser?
Well, we're trying to understand the dosimetry for the device. It's different. If you, at the conference in California, I actually showed a picture of a diagram where we actually measure the different number of spikes within the pulse structure of the laser. And it's different than the Perfecta. So we're all sort of learning how that different pulse structure will interact with human skin in general and the port wine stain in particular. So 5 joules of the Prima is not the same as 5 joules from the Perfecta. So Roy, Geronimus, and others who are high volume users of this device are trying to work these issues out, and we're doing it with caution. You know, we're probably maybe a little bit under treating people until we really see people back, make sure that there's no damage to the normal overlying skin when we're using this new laser with this very, very different pulse structure.
So it has nothing to do with the combination with the YAG. It's
No,
the individual pulse structure of that component of the Prima.
I mean, you press a button on the laser and you can get the YAG or the PDL wavelength. They're mutually exclusive. Okay.
Really great to know. I think this is the first time this has even been said publicly. So
the Prima laser is the same as the pulse dye laser. So the Prima laser has 2 wavelengths, as we were just talking about. The ND YAG, which is an infrared wavelength, which is very, very good for penetrating deep into the skin for the nodules and the blebs. And then the yellow wavelength, which is the pulse dye, the 595, that we use to treat port wine stains. So it is a yellow wavelength pulse dye laser. It's the same wavelength as the Perfecta, but as I said a few minutes ago, the pulse structure within these individual pulses that we deliver out of the laser is very different than the Perfecta, and that's taking us some time to make sure that that's safe to use on human skin and port wine stains. Okay, so we have questions coming in. Phyllis, I don't know that Dr. Nelson knows if Duke has a Prima yet. To be honest, I don't know the answer to that question. But you can call the derm department directly and just ask them. Roy's saying he's available for testing if we get the IPL, so that'll be great. Allie wants to know if the new Prima laser is appropriate for a 4-month-old with a port wine on the forehead. Sure, absolutely. We're treating infants and young children as young as a couple of weeks as an office-based procedure with the Prima, and have seen very, very good results with it. So I just have a question, like, what do you think the percent? Is it 10% more clearance, 20? Oh, it's hard. It's hard to say. I mean, what I will definitely say and have been impressed with is that a lot of the adult patients or older patients that we've had where we sort of ran into a wall where we really weren't seeing any more fading, we've seen several of those patients who've had a single treatment with the Prima, and it's really budged that port wine stain, where we've seen a lot of fading after a single treatment in a port wine stain that was previously refractory to the conventional Perfecta device. So, I mean, this is important for everybody to hear what Dr. Nelson just said. If you've had a couple laser treatments and you're not seeing any clearance and it's resistant, then the Prima may be able to get you some clearance that you haven't seen in a while. Maybe some of you have laid off because you haven't seen clearance. So you might want to get a Prima, and with our conference on September 26th in New York, the 25th will be the free laser sessions with Dr. Geronimus, who's a very, very similar to Dr. Nelson. You're both very similar in your practices. He'll be doing the free laser, and he will be treating with the Prima. So some patients will get the Prima. So we go live with registrations very soon. So Greta wants to know if, hi Megan, Greta, right here, Greta wants to know if the Prima laser is the same as the pulse dye. You did explain that. I think I already answered that question. Can you use the Prima on children? Absolutely. You answered that, and you said yes. Jody wants to know what the advantages are for the Prima versus the Perfecta. I have some deeper, larger vessels I'd like to see if it would help. I'm thinking of coming out in May. I just finished my 30th year of laser and had my 81st session. Well, the advantages of the Prima are several. Number one, that second wavelength, which we talked about, but the other advantage is that the laser has more energy associated with it. And the advantage of that is that you can deliver that energy on a much larger spot size. And I showed some pictures at the conference here in Irvine in October that when you use a larger spot size, you get a higher energy density underneath the skin as a result of using those larger spot sizes. And I don't want to get into the complicated discussion of physics, but it has to do with scattering of light within the skin. So the advantage of the Prima is that we're seeing a lot more energy being delivered deeper with the device as compared to the Perfecta.
Well, and this is great. And for those of you who just joined us, you'll want to go back and watch this from the beginning, because Dr. Nelson is giving us a lot of really important first-time information about the Crema Laser. And Hong saying that he just read an article that you went to China to learn about PDT.
Yeah.
And he said, what's your personal opinion about PDT in comparison to PDO? Do you know of any side effects of
Hematoporphin. Okay, I went almost a year ago to the date. I think a year ago, I was in Shanghai and observed a number of patients being treated with the PDT.
Which is PDT?
Photodynamic therapy.
Photodynamic therapy.
So they are using hematoporphin, which is a photosensitizer. The chief problem with hematoporphin is that that photosensitization not only goes into the blood vessels, it also goes into the skin. And so these patients had tremendous swelling and edema after their laser treatments that were done in China. And many of them actually had to stay in the hospital because they were so swollen after the treatment.
Yeah, I don't like
the advantage of the PDT is that it goes into all blood vessels. The disadvantage of the PDT is that they're treating with the green wavelength, which doesn't go as deep into the skin as compared to the yellow light. So we really need to see good comparative studies that compare PDT side by side with the pulse dye laser, where it's being done at multiple institutions by experienced investigators as a multi-center trial, and then we can really sort of evaluate that.
Superior information. Cassie's got a great question.
Well, actually, read the one by Dylan. I can't see it. Not a question.
Yeah, it wasn't a question. He's just saying he had a great result from the treatment with the
Prima. So Dylan had his first Prima treatment in December, and a lot of patients, in fact, you told me Glenn Effington, after I did his free treatment at the conference, had a tremendous amount
Tremendous amount. Cassie said, does it require the sedation like PDO? My daughter's 4 and her port wine is extensive. Chest, back, arm. She sees Dr. Williams in Atlanta.
Well, for a child who was 4 who has the extensive lesion that you're describing, I would probably do that procedure under anesthesia, not sedation. Now with that, we would not, by masking the child, we're not going to paralyze or intubate the child. But a 4-year-old with that extensive a type of lesion, I think would probably be best served to be done under anesthesia.
So great answer. Erin asked about how to find a doctor with a Prima. Well, actually they're buying them like as we speak. So every day the list changed, so we don't
You can call the manufacturer Candela in Wayland, Massachusetts.
Yeah, so Candela, I was just going to say that, Candela in Wayland, Massachusetts, or I don't know where you're from, Erin. If you're from outside the U.S., it's a little more difficult to find. But if you are in the U.S., like I said, every day they're changing in the different states they're getting it. So is it possible to eventually not need maintenance treatment? Or do a port wine stain need to be maintained throughout life?
Well, the problem with all of these is that there are some blood vessels in these port wine stains that are just so deep in the skin that we cannot treat them with the current conventional technology that we have. The light just is not going to go deep enough into the deeper layers of the skin to destroy all the blood vessels. So what happens is that we remove the superficial vessels, everything looks good, and then slowly and insidiously over years, you gradually see the port wine stain coming back. So at least with the technology that we have available to us in January 2020, I think we're probably going to still see some requirement for maintenance treatments.
So Greta came back with another, if you treat the port wine in the first year of life, is there a lower chance of the skin having surface changes?
Yes, absolutely, absolutely. And if you do the maintenance treatments as well, with the technology that's now available circa January 2020, no patient should have these surface changes or blebs like we used to see, and
if they're being treated.
If they're being treated.
If they're being treated.
As long as they're under treatment, and I would, you know, that's just not something we. I mean, we don't see just blebs as much anymore because we're treating people more aggressively, and we have better technology.
Well,
so the number of blebs and patients with vascular nodules that I see has gone way, 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 way down, at least in my practice, because we're treating them aggressively.
Well, that's the key. The key is that it's in your practice, and so they're part of your treatment practice. So you are seeing them. I'm seeing lots of people through the various groups that have the blebs, and that's because they haven't, you know, discovered a new specialist or been treated with the laser yet. So I think this is really important that everybody know. This is another reason you want to treat children early, is because you don't want to leave it alone, so that when they get older they have the blebs. It's critical. What are your recommendations? Christina says for the treatment involving scalp, eyebrow, any of the hair bearing.
Well, I let the family decide. I mean, we know that there's about a 20% chance of inducing alopecia in the scalp or in the eyebrow, that they will not recur because the yellow light will be absorbed by melanin, which is the principal pigment in the hair follicle. And this is particularly challenging in somebody who's got a dark hair, somebody who's a redhead or a natural blonde. They don't have as much melanin, so it's not as big an issue. But in patients who have very dark hair, there's about a 20% chance that they can lose those hair follicles permanently. Now, one patient I inherited from Arizona, the mother was actually a physician. Actually, the child did have the scalp treated many years ago at Phoenix Children's, had alopecia, and somebody suggested that they put the child on topical Rogaine, which is the hair-inducing drug. And the mother told me that the hair came back within a couple of months, even after the child had alopecia for several years. Wow. So I realize that's anecdotal, but maybe perhaps, you know, for patients who've had that in the past, you know, topical Rogaine, you know, may be an option.
That might be something we could do a study on, only because that Rogaine has got a lot of side effects. Like,
well, it's topical.
Yeah, but still, that's true.
You're not taking it orally.
That's true. So Jody has a great question. Her question is, how cautious should she be with, since these lasers are new, and, you know, should she find like someone like you that's a real pro with using the Deprima, or is it a pretty simple thing like the guy who's always used a V-beam should be able to use?
Well, it's a new technology. I mean, it is, you know, the first question was asked, it's a pulse dye laser, but how the light comes out of the Deprima is very, very different than it is the Perfecta. And so we're being very, very cautious. Actually, every week I have one of my researchers, Wang Kunjia, we actually go into the OR and actually measure the output and the energy that's coming out of that laser to make sure that it matches what the laser says it's doing. So, you know, these are important issues that people need to be aware of, that there is definitely a difference between the Prima and the Perfecta, and what, as I said, 5 joules with the Perfecta that we were using previously is very, very different than 5 joules now coming out of the Prima.
So are you seeing worse or less purpura? Like, what are you saying?
It depends. I mean, if the patient has a darker port wine stain, they get very dark purpura. If they don't have as dark of lesions, such as children, they don't get as much purpura. But what patients do get is a lot more swelling. There's no doubt about that. And maybe that's because of the more energy, the pulse structure, it's going deeper. So when we do these procedures, immediately after I'm finished, the first thing we do is put an ice pack on the area and hold it there for a good minute or so, because you're generating a tremendous amount of heat in the skin when you're doing this.
How long should the parents ice that area?
I tell them to try and do it 10 to 15 minutes out of every hour.
For how long?
The first 24 hours.
First 24. Really good to know. People are asking me this all over the internet that are saying, what is this swelling I'm getting with the Prima?
It's a lot of swelling, a lot more swelling with the Prima. There's no doubt about that.
But you're also seeing a lot better results.
Better clearance.
Especially with the babies, which
so you just have to warn the family that they're going to see a lot more. And we're doing the cases in the OR. I actually will have the anesthesiologist keep the child asleep for a couple of minutes longer, so we can make sure that we've totally done a good job icing down the patient.
Okay. Sarah says, hello, my daughter is 6 months old, been diagnosed with CMTC, and a large part of arm and hand, diagnosis with both CMTC and hemangioma, but several months of propranolol has resolved the hemangioma. Doctor thinks the rest is CMTC, is suggesting laser. Is it treatable? You know, if that's, I just would love to see that picture. Because if it's hemangioma and they think CMTC, it could be some kind of.
Well, I think she says she has both.
But I'm saying that's so rare that it would be both. I'd like to see it. Maybe it's a segmental type of hemangioma. I don't know.
It could be.
But she wants to know, the doctor's suggesting laser. Is the CMTC treatable?
The CMT certainly is treatable by laser. In fact, it tends to respond better than port wine stains in my experience. You know, we tell the family slowly with time, and by time I mean years, the CMTC vascular malformation will get better. So I primarily recommend it when the parents are, number one, concerned, or if it's in a cosmetically obvious area in a child who's going to school, we see this mostly on the legs actually. If the parents are concerned about the child, or a particularly young girl who's wearing a dress at school, then they don't want the lesion to be noticed, then we'll go ahead and treat those aggressively.
So I like this question, and I'd like to modify it a little. So Wendy's asking about the upper lip, but I'd like you to address treating the vermilion, the part that you put the lipstick on, versus the upper lip where the hair grows. So
well, we treat both areas. I will treat right on the lip. In fact, I did it a couple of times today, this morning, that we were treating some adult patients actually, and I treated not only the lip itself, but also the upper lip and the hair-bearing areas. And so I would treat both areas.
Male or female?
Male or female.
And there's no worry about removing the pigment from the lips when you're treating properly?
No.
Well, not if you know what you're doing. Right?
The only thing you have to tell men when you're treating an area on their face is that, related to the same question, if they want to grow a beard later on, the hair density in the area that you treat by the laser, you know, it may be a little bit, you know, the hair on, if they're growing a bilateral beard, the density may be different on the site that was treated by the laser.
So Roy wants to know who our adult contact is in Dallas. I'm not sure about
Well,
that.
I used to send everybody to my good friend A.J. Burns,
Jay Burns
at the Dallas Plastic Surgical Institute, but Jay is not doing as many patients anymore. I mean, Roy, I would tell you to call Jay Burns' office at the Dallas Plastic Surgical Institute, see if Jay will see you. I know he's not doing a lot of kids, but then maybe ask his office for a specific referral in the Dallas area.
Yeah, and let me know, Roy, because
I mean, you could certainly go down to Paul Friedman in Houston, who's one of Roy's former fellows.
That's right.
I don't know my Texas geography well enough to know how long it takes to drive from Dallas to Houston, but Paul Friedman is eminently well qualified. As I said, was trained by Roy, and he can certainly do the treatment.
He's our 2020 Physician of the Year, so he's great, Roy, really great. Phyllis wants to know, is it better not to use numbing cream if I can tolerate the laser?
Well, it's always better to not put anything on the skin as far as I'm concerned. I mean, if you can tolerate the laser, I prefer to do it without the numbing cream, but I leave that up to the patient. I mean, that's a decision that I will let the patient make. But I mean, there are other options. I mean, today I did several regional blocks. That if you put the cream on, you can get some alterations in the blood flow. There's been a lot of discussion about that. So, if it's in the V2 dermatomal, the classical, port wine stain of the Phantom of the Opera, and that's what Gaston Leroux was writing about when he wrote the Phantom of the Opera, somebody with a port wine stain. You can easily block that with an injection here in the infraorbital nerve, and you can block that whole area very easily. So, a lot of times, especially in adults, I prefer to do the blocks as opposed to the cream.
Yeah, I've seen the blocks used, and
very
it's
well.
Amazing. I saw a question, it's a good one, and I think what Carol Cower is saying is, you've been talking about the swelling now that you're seeing with the Prima. What if it's near the eyes?
Yep. The patients I warn the family, we are icing your child down aggressively, or I tell the patient, if it's an adult or a teenager, I want you to hold this ice pack directly on the skin, and I don't put anything between the ice pack and the skin. I don't put, a piece of gauze or anything. We put the ice right on the skin and hold it there until the patient can't tolerate it. But we have to warn patients, we're seeing a lot more swelling with the Prima as compared to the Perfecta.
So Caitlin, she's back. She's the one with the hemangioma and CMTC. So she's like, should we be doing the laser right now? Should we have done it from the beginning while we're treating the hemangioma? But
you can certainly do them. You can certainly do them together.
It doesn't matter. I mean,
you can do them at any time. I mean, when you're saying using the blood pressure medicine, do you mean? I assume that you're using oral propranolol to treat this hemangioma, but you can certainly go ahead and do the laser. We have lots of kids who are on oral propranolol to treat their hemangiomas, and I'm concurrently treating that hemangioma by laser. And in fact, I did a young child this afternoon who was 4 months, who was about 14 weeks old, who's got a hemangioma on the glabellar area. So you don't need to worry about that. Hi, Brianne. Thanks for your card. You've got your Christmas card. You've got a beautiful family.
Allie says that her 18-month-old port wine is fairly light after 3 treatments, so she's very fortunate. She wants to know, how do you know when to stop or to pause? Like,
I thought it says it every 4 weeks. I don't see.
She says,
where am I? Oh,
Allie Luce.
Oh, there's 2 Allie. All right, there's 2 Allies.
Oh, okay, sorry.
Sorry, I'm reading the wrong Allie.
Well, you let me do the reading. How do you know when to stop or pause treatment? She's 18 months old. She's had 3, and she's got in. She says it's fairly light now, but she wants to prevent any hypertrophy or blebs or.
I mean, I would treat it until it's gone away completely, or after 3 treatments I saw absolutely no improvement, and then I would go to a maintenance of 1 treatment, perhaps every 6 months or so. And if you do that, that will prevent the complications that you talked about. Right. The other Allie Lynn now.
Yeah, she wants to know, is every 4 weeks enough when you're starting, or should intervals be tighter together?
Well, the Roy's study that was done suggested that maybe even doing it every 2 to 4 weeks. And if we've got patients that are close here to the Beckman Laser Institute, where it's not a real challenge for them to travel, we actually have done it every 2 weeks. And it actually has worked very, very well. Whether 2 or 4 weeks is better, that I can't say that at this point. But certainly there are a lot of reasons to do it every 2 weeks.
So when you're doing it every 2 weeks, are you seeing residuum purpura from the previous
treatment? No, it's
treatment?
all gone. No,
it's all gone.
It's all gone.
Okay. Okay. So Sarah Gold said she'll send a picture to me, Dr. Linda. It's confusing to us, and that diagnosis went back and forth. So I suspect that, I suspect it may be. Detroit, Michigan. I mean,
there's somebody actually very, very good at Detroit, at the University of Michigan, Department of Dermatology.
Is that Linda Rabinowitz?
No,
Dr.
it's
Linda
a man.
Rabinowitz?
I just.
Well, maybe you'll think of it.
I can see him. I know him very, very well. I just am having a blank. I've sent patients to him at the University of Michigan, Department of Dermatology.
Okay, it'll come to you. So Sanji Bar said, how safe is it for babies with a port wine on V1 and the left eye? She's under specialist neuro and opt for Sturge-Weber. She wants to know, I guess, how safe it is for them to get laser.
It's very, very safe, just as long as you're making sure that there's a contact lens put into the orbit to protect the left eye. But we do those routinely in Sturge-Weber patients. Not a problem.
What about, does it no effect on the seizures?
Well, if the child is on anti-epileptics and it's well controlled, no, it should not be a problem. I mean, we do many, many children here at Beckman who have who are on anti-epileptic medication for their seizures, and I don't recall ever having seen a patient where the bright flash of the light had stimulated a seizure. So stop for a second. Just let me.
Okay, well, I'll just talk to Jody. Jody Lee just signed in.
I want to talk to Google.
Oh. Anyways, Jody, go back
Department of Dermatology,
to the beginning.
University of Michigan.
You missed a lot of stuff, Jody, that I think you're going to want to know.
I
So you might
found
want
one
to watch
option. UMHS Department of Dermatology.
I'll have to look it up.
Email
Linda. There's somebody.
Yeah.
He's well known.
You'll figure it out.
For fractional skin resurfacing, for inducing collagen. I've read his papers.
It'll come.
It's in here somewhere.
Yeah, you'll get it. Okay, so anyways, Jody, go back and listen right from the beginning, because there's a lot of good stuff that Dr. Nelson's talked about already. 1 year old that has Elandon Carey has a 1 year old who has a port wine on her left cheek, and we've had 9 treatments with little results. When do you stop treating?
Well, before I stop treating, I would want to have a look at the treatment parameters that have been done.
That's what I was going to say.
You know, these lesions are very heterogeneous in terms of blood vessel size and diameter. In fact, somebody named Vladimir emailed me over the weekend about, you know, different pulse structure, different pulse durations. And so many times, you know, somebody will be treating a port wine stain with exactly the same pulse duration, which means you're going to target a certain population of blood vessel sizes. And so many times, just changing the pulse duration of the laser exposure can dramatically give you improvement that you didn't previously see. So before you stop treating, I would recommend Elandon, if hopefully I'm pronouncing your name correctly, that you review with your physician the treatment parameters that have been used to treat your child.
I missed one by Brianne. So she's talking about adults getting clearance. Or she's saying, is Deprima more for clearance, like start right from the beginning, or just maintenance, like when you're at a resistance?
Well, now, I mean, for somebody who's got an adult stain that hasn't responded to the Perfecta, I would definitely go as trying to treatment, not just simply as a maintenance mechanism.
Okay. So Kelsey says that, do you think Deprima will cut the number of treatments needed?
Well, that's our hope. I mean, we've only been using this device since late last year. I mean, so we're talking about an experience that's about 4 to 6 months, not 4 to 6 years. So ideally, I'll be able to talk about that maybe in a year or so after we've had a much longer experience of treating patients.
Now, one thing that Dr. Geronimus said to me is with the spot size being bigger on the Prima, you're cutting down the time you're spending lasering. Do you find that to be
no,
true?
there's no doubt about that. I mean, the Prima, you know, you just do the math. You're going from a 10 to a 12 millimeter spot size, so you're cutting down
20%.
You know, you're almost 50%. Really, your anesthesia times are much shorter.
Okay.
Particularly when you're doing an extensive port wine stain that involves an extremity.
So Lori Ann says that, hi to both of us, you Huss. Her daughter has an extensive port wine, which has lightened approximately 75 to 80, which is very good, thanks to PDL and the Prima. It appears her last treatment on her leg has caused some hyperpigmentation. Can you share some more insight on this and whether treatment should be continued, or should the area where this hyperpigmentation be left to heal completely?
Well, the hyperpigmentation has to do with the fact that the melanin in the skin that causes you to tan is also absorbing the laser light. So the hyperpigmentation will go away slowly on its own. And by slowly, I mean by months. I mean, sometimes, especially in Asian patients here in Southern California, we do get hyperpigmentation. There's really no way to avoid it. And I will continue to treat the patient, but I will tell them you're going to have this blotchy brown discoloration as long as we're doing the treatment, because each time I do the laser procedure, I'm stimulating those melanocytes to produce more pigment. So I would not stop just because you had some hyperpigmentation, which, as I said, is transient and will go away.
In the old days, did they used to have them use like a hydroquinone?
Yeah, we will do that. Hydroquinone.
You still do that.
Well, in infants and young children, there's concern about hydroquinone. So, I mean, even better is tranexamic acid, which you can use in adults, assuming they don't have any history of stroke or any blood clotting abnormalities. And you can use very strong, concentrations of hydroquinone to get rid of the hyperpigmentation quicker. The problem is that hydroquinone can be very irritating to the skin. So I'm not a big fan of prescribing it for that reason. Then the family calls you and says the skin's all red, it's all irritated. I just say, look, it will go away with the tincture of time, avoid all ultraviolet light exposure, and use a good sunscreen.
So basically what Dr. Nelson is saying is that hydroquinone, those agents take the melanin in our body and they kind of quiet them down. They lighten them up. They actually
what it does is it interrupts the chemical reaction. If you go back to your high school or college physics, there's an enzyme, tyrosine, which activates the reaction, and the hydroquinone blocks that chemical reaction. That's how it works. But it does take time to work because if the hyperpigmentation you have is already in your skin, when you start the hydroquinone, it will stop the melanocytes from producing more pigment in the skin. So it's going to take at least 3 to 6 weeks for your skin to turn over and that hyperpigmentation to go away. So it's not going to, just starting on hydroquinone, it's not going to remove the hyperpigmentation in a week or so. It's going to take at least 4 to 6 weeks.
Okay. Adrian saying her son has been traveling to Dr. Geronimus. Due to finances, we can't, but we've tried multiple doctors in Cincinnati who only go by machine recommendation. Our doctor here said they just hit a button that says port wine stain, and there's no reason to try different settings.
No.
Are there any articles we could show our local doctor about the research behind different settings?
Well, that's what the company puts in, for the novice. And, I'm actually going through a promotion at the University of California this year. And over the weekend, I wrote my teaching statement. And what I tell the residents is not to focus on a number. Don't write down that, well, Nelson used 8 joules on this infant and young children, therefore every infant and young child that I see should be treated. All right, thank you, the person, Jody Lee. It's Dr. Jeffrey Oranger at the University of Michigan. I had the Jeffrey, I forgot the Oranger. Hopefully he'll forget me. So the woman who asked about the University of Michigan. But to go back, I don't even look at the manufacturer's suggested recommendations. What I tell the residents and fellows who work with me is look with your eye. Look at the tissue response. That should tell you what the optimal treatment energy should be for the procedure, not what the company manufacturer says.
Well, and then this is a shame because due to finances, she can't get to New York, but if she stays with those low-level settings that are just meant for manufacturing, she's not going to get the clearance.
Well, in the Midwest, I could certainly recommend Dr. Jerome Garden in Chicago. I don't know my Ohio, Illinois geography well enough. I know Indiana is in between. But certainly you could go to Jerry Garden is very, very good.
And if he doesn't accept insurance, I've worked with him for the discount rates for families. So if that's an option for you, let me know. I can even give you his email so you can write to him. Christina wants to know how frequently should an infant be treated with a V-beam perfecta for optimal clearance on the face? Do you prefer the Prima in this scenario?
I'm using the Prima now for all infants and young children for all of the advantages that we've already discussed.
Okay, Carol's saying, are there any changes regarding insurance?
No, we haven't. That has not been a problem. I mean, mainly the issue with insurance is that you've got to sit down and actually write a letter that's conscientiously and intelligently thought out. And my staff does a great job with submitting this, following up. I mean, it's extremely rare that we don't get authorization for treatment of a port wine stain or hemangioma for a laser procedure.
Well, you're lucky. I mean, it's because you have a great staff too, and everybody works hard, but not everybody has that. Minnesota, we have a consult with Dr. Zellickson.
You're in excellent hands. I know Brian Zellickson very, very well. Okay, you're in excellent hands.
We should get him on our list because
yeah, I know Brian very, very well.
We should. Kristen's on. Hi, Kristen Delgado. So maybe we can get this Dr. Zellickson in Minnesota to get his information so we have him on our list.
He used to be at the University of Minnesota. He's now in private practice.
Okay.
He's in Edina, Minnesota, which is a suburb of Minneapolis, St. Paul. I've actually visited his office.
Well, if you give him 2 thumbs up, then he's going to get our 2 thumbs up. Hong Hong says hi to both of us. Does the level of swelling with the Prima depend on the depth of the blood vessels being treated? My son had Prima treatment before, but I didn't see much swelling.
Well, our experience has been we get a lot of swelling. You know, you're definitely generating more heat deeper in the skin with the Prima. So, as I said, my staff and I always aggressively ice patients immediately after the treatment because of the swelling that we talked about.
But you said, too, because of some of the issues where they're working out these settings, you're holding back a little.
Yeah, until we've seen the patients back.
So do you think that it might be that some of the other new doctors that are using this are holding back even more and maybe not seeing the swelling because they're really holding back on
that? I if I'm not there,
it would be hard.
I can't say.
Okay. Okay, so Sarah just said thank you for the referral for Michigan. We see Dr. Tor Schwader, head of Ped Derm at Henry Ford.
To me, I don't know. I don't want to be pejorative. I just don't know the person. It doesn't mean that they're not qualified. If they're a pediatric dermatologist, you know, hopefully they've had some laser training during their fellowship.
So Roy, who has an extensive facial port wine stain, and you know Roy, I think you remember seeing him. He does have it in the neck and chin area. He's saying he's been having some scary swallowing incidents
So
maybe he should go to an ENT and get.
He should be. I mean, we have had some patients
palates
who've got, well, not so much the palate, but what we have seen is a lot of people get tremendous hypertrophy of their tongue sometimes. And I've actually had to refer patients to have debulking procedures of their tongue. So, I mean, Roy, you should be evaluated by a good ear, nose, and throat surgeon who's experienced in the clinical management of patients with vascular birthmarks.
And if he comes this way ever, Roy, I mean, Dr. Levitin has been scoping people in his LA office here in Los Angeles, so that's an option. And he's a good ENT, so he knows what to be looking for a vascular birthmark. Oh, this is a good one that you'll like, Dr. Nelson, because I know you have your connections. So Shelley is looking for somebody in India, Bangkok, or Singapore, and I know you have a good friend, right?
Well, I don't know anybody in India because I did not make the VBFI team to India. In Bangkok, I can highly recommend somebody who was one of my former trainees. He's a Dr. Niyam Tantakan, and he is in Bangkok. In Singapore, I can recommend Dr. Chi Lok Go. He's in private practice. I know at the National National Laser Center, there is a National Laser Center also in Singapore, and there's a physician there who also is treating patients. So there are options in Bangkok and Singapore, but unfortunately, I don't know anybody in India or Bangladesh.
Yeah, we don't have anyone on our list. When we left the eye team
who treated the patients in India? I wasn't
Dr.
there.
Geronimus.
Oh.
So what about Dr. Henry Chang?
Well, Henry Chan is in Hong Kong.
Chan, he's in Hong Kong. So that's another
possibility.
Resource for her. So Lori says, thank you. I prefer not to use any topicals so long as she will heal, but also don't want to implicate her in other ways by continuing to treat. Thank you so much.
You're very welcome, Lori.
Okay. Another person sees that, Dr. Zelikson,
Zelikson.
Okay, so, you're going to be in New York. I think you and I have we communicated about this? Because I think you're seeing Dr. Geronimus, right? Elandon on the 26th. So that's really good. April's on now. Hi, April. Susan Klingbeil, have you heard of any new topical creams or drugs coming out for using with the port wine?
Unfortunately, no, we are not that. We haven't. We're still trying to get a topical study with another anti-angiogenic inhibitor going, but we're meeting some resistance from the company because they're concerned about us using that for an indication which isn't currently approved by the FDA. So we're still working on that.
There's been several patients that have emailed me out of Europe that they're being treated with sirolimus,
the topical rapamycin.
And
we haven't found that to be particularly helpful. Roy has not found it to be particularly helpful. Rox Anderson told me in Boston he has found it to be helpful. So it's controversial. So I just that the rapamycin's expensive. It can be irritating to the skin because it's not very soluble. You have to use high concentrations of benzyl alcohol. So we are not routinely using the rapamycin, and Roy is not doing that either right now.
Okay. So what you're saying, Dr. Anderson is saying.
The Rox says it helps, so he's prescribing it.
Interesting. No longitudinal studies that we can reference on this, right? Yeah. Okay, Christine is saying we were scheduled to see Dr. Cohen. He's one of our best at Hopkins, but have been told he won't treat the eyelid in infancy. We just posted the video on the corneal shield. I don't want to miss any opportunity to treat her eyelid. Can you advise?
But we do it routinely. I told you I treated earlier today a 14-week-old, and we popped the contact lens in as an office-based procedure and did it. Port wine stain did involve the lower eyelid, so we went ahead and treated that. So I just don't know why Dr. Cohen won't do that. Perhaps he doesn't have in his office. Unfortunately, you need a whole different sizes of all of these contact lenses, because you have to use them on an individual patient basis. You can't just buy one and then treat infants, young children, teenagers, and adults. And each one of these contact lenses is about $300.
Yeah, I heard that they were $300 or $400.
So they're very expensive, and you need multiple, and then you need to sterilize them between the patients. So it can become a cost issue. But and you can certainly go up to New York. You can take the train up to New York and have Roy do it.
So I have been and observed doctors doing lasers in different cities in the world, and I've seen them use gauze over the eyes. I've seen them put little goggles over the eyes.
I don't like to do that.
I know.
I've seen too many cases of eye injuries, you know, and so anything that's anywhere within the orbit, above the orbital rim, below the orbit, top of the orbit, I will always put a contact lens. And I do that not only in patients who've got vascular malformations, but also for patients who are having cosmetic procedures, people who've got blood vessels on the face, blood vessels on the nose. You know, we treat them exactly the same way. And I'm proud to say that in the 34 years of the Beckman Laser Institute Clinic, we have never had an eye injury.
Thanks,
there have been 3 injuries within the building on the research side of the clinic because people did stupid stuff. But in the medical clinic, we have never had an eye injury.
So if I get pulse dye laser with you, you're going to pop a lens in my eye?
No, I'm just going to punch you out. Then you'll go to sleep.
Oh, that's a good idea. Knock me unconscious. Sarah Gold said, thank you. What is the name of the group? Oh, you were replying to Jody. Okay. I love about Dr. Okay. That's people are talking to each other. Oh, Zach Khalil from Sao Paulo is on. Hi, Zach. How are you? You got to come to one of our conferences. We're going to be in China in December, so maybe we can come.
Where in Brazil is he?
He's in Sao Paulo.
Oh.
And he does amazing work with giant lymphatic malformations. He's on our website. So Greta's back on, and she's saying, when treating the eyelid with the eye shield, are you putting the patients under anesthesia? No, you don't.
No, we don't need to do that. We do it in infants and young children. It's just a matter of seconds to do it. My staff is well trained to hold the child. We'll give the child some sucrose on a bingy end, you know, and that works very, very well.
All right, so Jody's bringing up a really good point that a lot of other parents are going to bring up, and because she's on the board, she gets a lot of information early, and I know for a fact, because I know Magana, her daughter, that her port wine has become resistant. So, and your buddy Oranger is treating her, so you know he's a good doctor.
He's a very good doctor.
But I haven't seen much improvement in the last 3 treatments at all. I haven't seen it because I keep in close touch, and she came. She was at the conference that we just had in California. So Meg was there and seen by everyone. So she wants to wait on using the Prima, Jody is saying, because wants to wait till she's more comfortable with the bugs that you're working out. Or do you think it's okay, you know?
It's okay. It's okay.
Oranger,
as long as somebody has had the proper experience. As I've tried to say repeatedly, you know, and I tell the residents, you know, patients are not pastries. You know, do not use a cookbook recipe to treat people. You deliver the pulse of the laser and you look. You see what is the tissue response, and then you can adjust the energy of the laser up and down based on what you see. So, I mean, Dr. Oranger is highly experienced, and I would trust his judgment with the Prima.
So I think she's saying they're not comfortable yet, because she's saying it's a bad idea that I stick with the Perfecta until he and his team are more comfortable. We're down to 4 or 5 treatments a year. But like I've told you, you said it before, 2 or 3 subsequent treatments with no clearance, then you need to switch the laser, switch the settings,
switch the pulse duration of the laser.
Yeah. Correct?
Yeah.
Could be the technician. So honestly, I know it'd be hard on you, Jody, but
you're in good hands with Dr. Oranger.
Yeah, hey, just tell him to go for it. Right? Tell him to go for it.
Well, people will email me and they'll say, you know, is this what I should do? And I email, in fact, this man Vladimir, I emailed this back this morning. I said, you know, your physician should use treatment parameters that they are comfortable with. You know, what Roy and I do is very, very different. What other physicians do, the degree of overlap of the laser pulses, you know, how many passes of the laser do you make in a certain session? Often we'll make 2 or 3, but I don't want to tell somebody else to do that because I just don't know what their level of experience is or what they're doing. So,
you know, I have that brief video of you. No, you weren't using the Prima laser. You were using the V-beam during the conference that we took, right?
No, it was the Prima.
It was?
Yeah, you did it for Candela.
Should we are we able to show that? I mean, we have permission from the patient.
Yeah, I don't know whether they signed a
Yeah.
consent. I don't know.
Okay, yeah, I think so.
If not, we can do it again, and
Yeah,
we can,
if you
I
can
can have
get-
Wang Kun do it. I mean, we
Yeah.
can get consent. Sure.
Yeah, because I'd love patients to be able to see that in use, and they would all love that as well. Okay, so
International Laser Centers on your website.
yeah,
Do you have a list of treatment centers in the United States? I haven't been on your website for a while.
yes. Well, we do have that, Heather. You can, if you're not finding it, again, we have a new website. We've had moved files over. You click on the button that says Find a Doctor, and you'll see the map of the U.S. So I don't know what Dylan's saying. Hashtag patients are not.
I said that.
Oh, you said.
Dylan's teasing me because I said to the resident, you know, patients are not pastries. Do not use a cookbook approach. You don't work in a bakery. You work in a clinic. You're treating human skin. Don't obsess with the number. Look and see what you see.
I think we might use that hashtag throughout the year, Dylan, in our social media. Patients are not pastries. So Susan's saying her son's new doctor is having her 3-year-old son use rapamycin twice daily every day. We did our first Prima after using the Perfecta 20 times. It seems to have lightened, which is great.
Good. The Prima, that's good.
She's
Glad to hear
seeing
that.
good results with it, but she said they are trying to find more drug targets to use for the test study he will be in once she gets the OCT.
Yeah.
So that's that optical
coherence
tomography. Stacy saying, do you have any feedback? Oh, Dr. Cohen is amazing. I mean, I've worked with him a lot. I just found out that he doesn't use an eye shield to treat the orbit, but he does 90% in the room without anesthesia. Those that need anesthesia, he does it, but he treats a lot like Dr. Geronimus. So I'm very happy with the results I'm seeing for Dr. Cohen, and I refer a lot of people directly to him. So Jody says she's just nervous about trying something new on Meg. Okay. Sheila's saying, please send me the names of the specialists that Dr. Nelson just mentioned. He's going to have to text those to me, the names in the Bangkok, Singapore, whatever area.
Yeah, that's not a problem. I'll send them to you tomorrow.
And then we'll post them to you here. So,
remind me to send Linda Shannon information on Asian physicians in Thailand and Singapore tomorrow at 10 a.m.
Okay.
All right. My phone will remind me to do that.
Okay, Brooke.
Okay, you're
Done.
Brooke is saying she tried Timolol. Timolol doesn't work for port wine stains, but
works very, very well for hemangiomas.
Right.
That child I was talking about with the glabellar hemangioma,
Yeah.
just amazing. Even with 2 or 3 weeks with the laser every other week, it's almost gone.
So Lindsay Munn, I think, is Annie your patient?
Yeah, in fact, I'm seeing Annie tomorrow. I'm looking forward to seeing you, Lindsay.
Ooh, yay.
I'm sorry I didn't answer your question through the patient portal. I was out last week because I had a very bad flu. But we can talk tomorrow, and I am definitely treating your daughter with the Prima.
Yay. Take a video, take pictures. That's really great. Okay, so will you treat without having being put out? That's what Jody wants to know. Will you do anybody without anesthesia?
Sure, with topical, locals, absolutely.
Okay. And the nerve block.
The nerve blocks, yeah, that's what I meant.
Great.
Local. The nerve blocks work we're doing
So
a lot
great.
more of that, particularly on adults. It works very, very well.
Jody's saying we're hilarious, Stuart. Dr. Nelson. Well, listen, everybody. We've got 7 minutes. This has been a rapid fire. Lots of amazing questions. We still have 6 minutes left. I highly encourage all of you in any port wine stain groups that you're in to share this, because Dr. Nelson has given right from the very beginning important information on the Crema Laser, important information on the Perfecta, about treating in the hair-bearing area, about using the bleaching creams, just a lot of information that we see repeatedly. And, Dr. Nelson said to me today, maybe we don't need to keep doing these. And I'm like, yeah, but you're forgetting babies are born every day. and those parents don't have all this information, plus new things come up. So today's a perfect example. I don't know what it'll be by the time I'm done, but I'm pretty sure there's been over 100 inquiries, and that 102
questions.
So that tells you right there. I mean, you know, the last session we had 38. So that just tells you how busy this is. A lot of thank yous are happening. We can take a few more questions, but once again, I want to, so Greta's on there. If our boy has glaucoma, will that affect the use of an eye shield? Good question.
No, not at all. The only question sometimes is that if your child has had glaucoma eye surgery and the ophthalmologist has put a valve in to drain some of that, sometimes we'll want clearance from the ophthalmologist to make sure that putting the eye shield in itself will not disrupt that valve that they've put in. So
very important information.
So we'll ask that. But if you have glaucoma and just being treated with drops, no problem to put an eye shield in.
Okay, I just learned something new. So a couple quick questions before we leave. Susan wants to know, have you used OCT?
We have used the OCT.
With
in fact,
stains.
We were actually the original paper on OCT of port wine stains. I actually published with one of my former fellows.
That was you.
And so, I mean, the problem with the OCT is that because the skin is highly scattering, you can really only image the most superficial layer of the blood vessels. So you can't really probe deeper down into the skin. So how useful it's actually going to be to guide therapy, you know, remains to be seen. I mean, when we first wrote a paper about this more than 20 years ago, we were very excited that we could get an average blood vessel diameter and then choose the pulse duration of the laser exposure based on that average blood vessel diameter. So how much the OCT is going to help, we're going to have to see.
That was great. Brooke has a wonderful question, and she says that her daughter has a lot of anxiety and that she's really held off with the treatment because of it. And, you know, I hear this a lot from parents. Yeah. Is there anything that you can recommend that they give her to, like, some mild sedation, or is there something that we could suggest?
Well, I don't know how old your child is, Brooke. For some of the older children, sometimes we'll have them take.
She says she's 10.
You know, for a 10-year-old, you could certainly consider maybe the night before a little bit of Valium, and then a little bit of Valium earlier that morning before the treatment. And sometimes we have used Versed, which is an oral anxiolytic agent. The only problem with the Versed is wonderful. It puts the child down and calms them down, but then they're sleepy for a couple of hours. So when you're talking about doing a laser treatment that only is going to take 10, 15 minutes, having the child sleepy for 2 to 3 hours isn't such a good idea. But, you know, a little bit of Valium the night before and that morning, we have found works actually quite well.
Yeah, it's a tough call because you want to stay ahead of the port wine stain.
Yeah. And
so maybe a couple hours sleepy isn't a big deal. You know, that mom has to make the best decision for her child. Everybody is thanking us. Great question from Allie Lynn. Before we head out, we got a couple minutes. Her child's port wine barely kisses his eyelid. Would you treat it or not?
Certainly I would treat the eyelid. As long as you have a contact lens to put into the orbit to protect the eye, there's no reason not to. It's very simple to do.
And also, Allie, just so you know, even though it barely kisses it, do not rule out having an annual glaucoma check. Yeah. Dr. Comey and I just in November did the Sturge-Weber syndrome Facebook Live session. You can go back and look at it. And she said you have to have it done every year. And every year that it says no glaucoma, you have to keep going throughout life and have that done, because she mentioned having a patient like 70-some years old present with the glaucoma. So the glaucoma can present at any time, and even if it's just a tiny bit near the eye, you should still get it checked up. So you agree with that?
Yeah,
right?
Absolutely. Yeah. Absolutely.
A lot of thank yous. Dr. Nelson, have a recommendation for LPTH out? I don't know what that means.
I don't know what that means, Jody. I'm sorry. I don't know what that acronym means.
I don't know what that means either. Any recommendations about moisturizer over the port wine?
We simply use Vaseline. We have found that to be fine, you know, especially during the purpuric stage. After that, I recommend Cetaphil because it's very hypoallergenic. So those are fine.
Phyllis great shout out there. She's like, boy, have we come a long way since the old argon lasers that traumatized people for life because they were so painful and so much scarring from those, right?
The problem with the argon laser is that the pulse duration of the device was not short enough. And so that's why you got all of that collateral damage to the skin, despite the fact that the green light was absorbed by the blood vessel. The problem was the pulse duration of the laser exposure was too long, and the heat was being conducted in all these different directions.
So Jody wants to know, do you know an ophthalmologist for glaucoma in the LA area?
Well, both my parents had glaucoma, so I'm at risk for glaucoma. So I see Dr. Sameh Musayed at the Gavin Herbert Eye Institute here on the University of California campus here in Irvine. I'm certainly, you've got the Jules Stein Institute at UCLA. Also, USC has the Doheny Eye Institute. So you could call any one of those institutes and request to see a glaucoma specialist.
By the way, Jody's going to be working with us on creating a list of glaucoma experts in the U.S. for us to get a link or something. Okay, we have to really go through because we're right down right now. My 7-month-old was born. That covers her whole right side of her face. There's no question. Oh,
True.
How early can you get laser? Right after.
Immediately, tomorrow.
Immediately.
Tomorrow.
So thank you all. We are going to be signing off. Dr. Nelson, phenomenal job as usual.
Thank you. I thoroughly enjoyed it.
I have to give you the huge kudos for our 2020 first Facebook Live of the year. 2020 does mean perfect vision, so we're ending on a great note with the glaucoma question. Thank you all, and we'll be back next month. I forgot where I'm going to be with Facebook Live next month in February, but we will post it on our website. So thank you all. Have a great month, and don't forget to watch the Super Bowl.
Happy New Year, everybody.
Happy New Year.